we're very glad to have three works, different works, will give us an idea, a precise idea of the different ways art is benefic to our health, uh, mental health system and patients in psychiatry. I'm not going to be any longer. I'm letting Isabel Amado, Dr. Isabel Amado, present herself. As always, I send you the list of participants in order to see who they are, but I'm going to let every one of you present yourself. Isabel Amado, then we're going to have the team of the Art Mediation Center at Santan, and then we're going to have the Dr. Antonio Diaz from Mexico. Please, Isabel, thank you very much.
Okay, do I have the... Yes. So, do. Okay. So thank you, Alberto. Hello, everybody. I'm Isabel Amado, and I'm working in Paris, and I'm in charge of a unit of cognitive remediation and psychosocial rehabilitation. So I will briefly, in the first part, I will introduce you what is that kind of unit in psychiatry. And in the second part, I will show you what we can do with art to apply the rules in the domain of art, the rules of cognitive remediation. So we know that in schizophrenia there is a cognitive deficit which involves memory, attention, executive function, and social cognition. And 70 to 80% of patients are concerned. That's observed in almost all the patients when we refer to their own premorbid level of functioning, and that's present since the prodromal period, and that differs from one patient to another. And the cognitive difficulties concern neurocognition, tightly linked to determinants for insertion in the community, and social cognition, which have more impact than neurocognition to integrate people in the community. So what are the main rules of cognitive remediation? First of all, there is cognitive training to improve performances in an altered function. So you train with a cognitive target, and you learn strategies to solve problems. And the first meta-analysis, which was in 2001, found that it was not the results were not convincing. So after this first meta-analysis, it was decided to really confirm that people have learned strategy and can adopt different strategy to solve the task, such as verbalizing instructions, learning without errors, providing feedback with individual or group methods. And also now we add cognitive remediation to techniques, tools to adapt also the social environment with virtual reality or digital assistance, and that's tightly connected to rehabilitation and other psychosocial therapies. So when a person is coming, we do a multidisciplinary assessment with a medical interview to check the criteria and determine if there is a need for neurocognitive or social cognition programs. And then there is a neuropsychological assessment with neurocognitive as well as social cognition tasks. There are then nurses in charge of the functional assessment, and they use specific tools to link cognitive functions to daily life and to identify priority dimensions to gain in autonomy. So we built with colleagues from Lyon and colleagues from Tours in France, a social cognition battery, which is now completely validated. And it has been validated in schizophrenia, in autism spectrum disorders, and also in addictive disorders, mainly alcohol consumption. After doing this multidisciplinary assessment, we use for cognitive remediation tailored programs adapted to the cognitive profile. And here I listed the neurocognitive programs we are using. We can use programs with individual program or group program. IPT is a very old technique with rules for neuropsychology, but not exercises done by the patient himself. But it's the oldest therapy and it works. We use a virtual reality game, the serious game Maturin, which is an immersion in a virtual town to learn how to plan daily life. For severe cognitive difficulties or mental retardation, we use a paper pencil method, which is the name is cognitive remediation therapy, but that's an individual method. For people who cannot follow group sessions, like people with autism, we use RECOS, which is a Switzerland technique with computer and paper pencil tasks. And for the vast majority of persons, including autism and recent onset episodes, we use the NEAR program, which is an acronym for Neuropsychological Educational Approach of Cognitive Remediation, created by an American person, Alice Medaglia. Also, we have programs in social cognition, Tom Remède, which is a group program for theory of mind difficulties, Gaia, which is a program which focuses on facial emotion recognition with training about that, Skyless, that's a program we created for people who have difficulties of empathy, difficulties with very few theory of mind abilities, and also difficulties to recognize emotion. For people who have interpretative thoughts, we have the SKIT program, which focus on attribution bias, and that's a group therapy. Attribution bias, like people who think that people are against them, they want to be bad to them, to have bad feelings, and RC2S, which is finally a very good method, but an individual one for all the components of social cognition. So as you can see, we have different, a big panel of psychosocial therapy to develop. And in red, you have the psychosocial therapy that can be used very quickly after the first access to a hospital or to psychiatry. So psychoeducation for the information of the disease and the treatment. Also psychoeducation for the caregivers. CBT to see how to regulate emotion and stress. Motivational interview when you have difficulties of insight or motivation or addiction troubles. Social skills, which is included in a method for social cognition. The problem of housing, that is one dimension of the rehabilitation. And we have the case manager who works in the team for that. the techniques for cognitive remediation to enhance neurocognition, social cognition, and self-esteem, supported employment with social worker and job coach who are integrated in our programs. And after that, they help people to find job. And also the somatic dimension with adapted physical activity, and we have an adapted sport teacher who comes twice a week. And also we have a big help with the peer supports and the experts users, patients and families that built with us the programs and that participates to the driving of the programs with our team. And also we have a very important moment, and I created a model which is called the stepping stone model for recovery, because we do the cognitive remediation just in time for the project of integration in the community, because we know that the improvement in cognition is after the end of the program is lasting only 6 to 8 months. So we have to calculate the good window to do this program in order to make the person completely ready to achieve an exam or to begin a new job or to come back to studies. And we helped with social and medical social partnerships with the job coach. Also we can train them to philanthropic activities, and also we have peers group that could help them to achieve their project. So in fact, we have a personalized course for rehabilitation, because nobody has the same priority, and we have a project for each person trained in rehabilitation. And you have to check that all the different dimensions, family relationship, cognitive function, work, body care, hobbies, social relationships, and in hobbies, leisure and culture, are in a satisfying way for the persons. And if it's a problematic dimension, you have to train it in order to achieve the project for the concerned person. So for that, in fact, you have new needs that emerge with the rehabilitation team, and we strongly work with peer support, who are members of our clinical team, case manager, who helps and coordinates the different steps during the course for recovery and who check for the environment of the person, expert for job employment, job coach, I told you about that. And in France, we have an instruction from the Ministry of Health to promote psychosocial rehabilitation. And now psychosocial rehabilitation is included in the international guidelines for schizophrenia. We also create a day unit in the 15 area in Paris, completely oriented toward integration and recovery. And in 16 months, we prepare the person to be ready for her project. Where the person is hospitalized, in the first phase of 6 months, there is a consolidation, mainly focus on psychoeducation, treatment adjustment, and restructuring daily life. A second phase, there is functional readaptation with CBT, physical adapted activity, group therapy. And at the end of phase 2, 6 months or so, you have the neuropsychological evaluation, and then you begin the cognitive remediation and the construction of the project. And after that, we saw that 50% to 70% of people were leaving the day hospital in 7 months, in fact, and after 2 years, more than 85% of people are keeping their project. So this is a paper which is just in press in English in the review L'Encéphale. So we know that it's a very good model for preparing in this day unit for rehabilitation. So how is the place of art in this new dimension for care? First of all, the meta-analysis concerning efficiency of cognitive remediation highlights 4 main points. Training of the therapies, that must be very strict. That must be associated to psychosocial rehabilitation, transfer to daily life, and cognitive remediation programs have to be more than 3 months. So we know that the programs are much more efficient when there is transfer to daily life. And there is a study in 2010 which demonstrates that if you put cognitive remediation plus social skills and transfer to daily life, you have a better quality of integration in community and home management. So, for example, if you take an exercise of cognitive remediation, this is an exercise of the cognitive remediation therapy in the module flexibility, and you have to put just a mark at the middle of each segment you have here. And that points initiation of task, attention, and that involves also perception and treatment, perception speed, and speed of treatment of information, and flexibility. So the application in daily life can be walking and describing what you see, discriminating a detail on a painting on a statue or a statue. For example, working, helping the patient with an exercise from the book Where is Charlie? That's a very famous international book. And I put here the photo of the Olympic Games in Paris 2024, because you can use that to put stimuli and to invite the person to find, for example, the mascot, I don't know the term in English, which is held in painting. Also, if you take the module memory and working memory, you can have a comprehension exercise with a short verbal text, with asking the patient to see if he really paid attention and understood each sentence. And in the homework task, he can select a book and recall a chapter. For example, we had a person who wanted to come back to the books of Marcel Proust. And after cognitive remediation, he was very happy because he could read again the book of Marcel Proust, and he decided to be member of the association of the group, supportive group of all the books of Marcel Proust. Also, we had a patient who was fond of a comic, Titeuf, a French comic, and we selected a comprehension task with this kind of comic. Also in memory, we asked patients to details and to memorize a painting in a museum and to come back and to describe us what was the painting she or he selected. So it's one of the home tasks we can do. And here, from this picture, you have to memorize in immediate memory, and 20 minutes after, you have to reproduce this difficult picture. When you give homework task, you have to memorize film, to memorize articles you read in the newspaper, or to memorize theater text. So we did that with different patients. In the module planning, you have to make verbal association, and here that's written in French, but you have to choose one of the 3 words here corresponding and linked to the different words that are described here. So when you find a homework task that could be linked to this kind of exercise, you can do, for example, sequencing comics or mangas with several images, and you ask the person to put them in the good sequence. So what we know in the literature is that cognitive remediation and art has been, there are very few papers now, but one about anorexia with obsessive compulsive disorder find that when you compare familial therapy and cognitive remediation versus familial therapy and art therapy, there is a reduction of obsessive cognitive disorder in the 2 groups with less perseverating errors in a test, the Wisconsin card sorting test, in the art group. So also the NEAR program of cognitive remediation was associated with the bridging group, which are CBT group to enhance the transfer to daily life. And these bridging groups were including a practice of a musical instrument or group singers instead of initiation of a conversation with peers. And what was found was an improvement of verbal fluency and attention, less social withdrawal, and reduction of affects with the group of practice of a musical instrument. Also, there was a paper about cognitive remediation versus dancing in schizophrenia, and you find an improvement in flexibility in the 2 groups after cognitive remediation, and social functioning improved after cognitive remediation only. There was also an author that proposed the musical activity associated to cognitive remediation to enhance some cognitive functions, to involve specific cortical area and subcortical area, to promote engagement, to modulate emotion, and to also target the level of consciousness, psychological domains, social domains, motor function, and also the cognitive function, the main cognitive function themselves. So you can use the music with strategies of cognitive remediation with involving the main cognitive function in attention and perception, memory, executive functions, and psychosocial aptitudes with the music, because you can train musical engagement, you can train attention and discrimination, musical memory cues and associating mood and memory, musical executive function, and psychosocial skills. So when you put exercises of cognitive remediation associated to these different functions involved in music, you can put this link between art and therapy in music. Lastly, I wanted to show you the results we obtained 2 to 7 years after cognitive remediation. We did a clinical survey. It was published in Frontiers in 2020. And we showed that people after cognitive remediation had obtained better integration in the community, in professional activity with open jobs, also coming back to studies, having independent housing, and doing more physical activity and having more time to read and to do other leisure. And also, we decided to compare a group of people who were doing cognitive remediation 7 years before to another group of people who have had cognitive remediations only 2 to 3 years before. And what we saw was that, in fact, people who were trained more than 5 years before were keeping their job and continuing being active in the community, with also very few relapses between the two groups. In the two groups, more than 1/3 of relapse. And when people were doing recurrency of the disease, it was only 1 episode. So that's what I wanted to show you, and I wanted to thank you for your attention.
Thank you very much, Isabelle. Not only you're very clear when speaking in English, the whole presentation was very easy to follow. And let me tell you that I know you're not going to be there for a discussion at the end, but we might keep questions and I will send them to you in order to continue. And I can remind you that this is just a previous work. We're going to be working together in September, but this gives you an idea of the quality of working of Isabelle. I really thank you. You got my attention all the time, which means I am already in therapy with this kind of content. So please, I'm telling everyone to send questions. Isabelle is going to stay a little bit, but then she's going to go to another conference at 16 p.m. And I want to respect the idea of having the 3 presentations and then a general conversation. She will be there until the moment she can. Thank you once again. So I am calling, and please keep this in mind. This is the first contact moment. We are going to rework this in a conference. This is very important to find the mechanism of how we're working. So I am asking now the Therapist Mediation Center of GSU, and I will let the person present herself, since I didn't receive the name of who of them is going to present the work. And we're very pleased to have you. And of course, please take 1 minute to present yourself and your work, and then we'll be confident to hear you more. Thank you very much. Please.
All right. Thank you very much. And I'll introduce myself. So my name is Fiona Allison Bernard. Here we are at the CNME, Santan Hospital. I'm with my colleagues, our medical director, François Chabli, and other art therapists. Voilà. So I'm going to start my presentation. Okay. what I'm going to do is I'm going to start with a brief, very, very brief history of the art therapy in Santan. So I'm going to go back to 1954 with Professor Delay, who set up the psychopathological art department at the clinic of the Maladie Mentale and Encephale. So mental disorders and brain disorders. And this was also done with the Professor Volma. Then I'm going to go later into 1973, because in 1973 there was the psychopathological art department, which became what it is today, the Center of the Study of Expression. Its mission is to teach art therapy, research, document, protect and promote the Sainte-Anne collection, of which, of course, Dr. Anne-Marie Dubois avait élaboré. But what I would just like to say, because I've got to go back now, I've got to go back to actually how art therapy became. Because at the beginning, like just after the 1950s, we saw in Sainte-Anne more art workshops. Patients would go to the art workshops, and what happened was the carers really felt that we needed to create a psychopathological regard of these works. And so from there developed what is today art therapy. So voilà. So this is just what I want to say briefly. Of course, there are very important people, and I'm going to say their names again. I'm going to say Professor Delay, I'm going to say Professor Volma, and the art, you know, and we have to really remember these people. Okay, in my opinion. Okay, so now what I'm going to do is I'm going to present our department. So we are comprised of 8 art therapists, a medical director, and a coordinator. The art therapists, we come from different backgrounds, but we all share the same fundamental training. Our programs are fundamentally the same. We're all graduates. We come from the same theoretical framework, which is comprised of psychodynamic, which is comprised also from cognitive behavioral therapy, and the art history. So we share the same setting in our approach. We have the same artistic trainings, but our dispositives are diversified in the workshop. We're all coming from our own artistic background. We're all artists, we're all coming from our own backgrounds, and so we all have our own references, which is in link with the mediation. We actually have 20 workshops, therapeutical workshops weekly here in our department. We have the visual arts, we have sculpting, drawing, music, theater, drama therapy, writing, and dance movement therapy. So we encourage the creative process. However, we prefer to think of it as a pathway to creativity. Okay, just give me a minute. Now, I just have a drink of water. So the art-mediated therapies use the creative process as a lever for change and transformation, for therapeutic and psychotherapeutic purposes. Fundamentally, non-verbal therapies being the primary purpose of using into re-establish access to symbolism and creativity in the broadest sense of the word, and to open up a whole range of thought and thinking about oneself differently and without judgment. The artistic language allows for a vast and less controlled field
This is a network problem, of course. I hope they know we're not following them. Ah, yes.
I'm back.
Oh, there you are. Thank you. Thank you. We lost you for 2 minutes.
Some technical problems.
Okay.
Yes. Okay. So this care allows for the patient to work with the art therapist to explore their emotions, understand conflicts or feelings that are causing distress. Artistic expression can be the means in resolving these issues. The care helps and accompanies the patient to get closer to his or her psychic life, his or her imaginary life, and to connect to him, herself, and to others. The art therapist, while working on therapeutic alliance and relationship, supports the patient with proposals specific to his or her artistic background and practice, encouraging the discovery of new fields, boundaries, and potentials. Patients can pursue their projects and explorations, trying out new experiences and working around technical obstacles, enabling to gradually reduce their resistance. The art therapy process encourages expression, sensation, perception, and socialization, making speech and the body freer and more embodied. Now, like any new experience, the creative process involves risk. The art therapist is there to support and contain what may destabilize or even overwhelm the patient as they embark on a creative process, the implications and impact of which some are not yet aware. Creating also means confronting solitude of the act in front of its subject, being a gesture, an expression of the gesture, its influence and the resistance it may encounter. We would like to distinguish art therapy. Hang on, I just need to write the paper. Just a second. No. So we would like to distinguish art therapy from other artistic practices, including what we call the reception of the work. Can you speak about what you wrote earlier, because I don't have it anymore. So the patient needs to find an excitation barrier, someone who can receive and contain. The therapist is there to contain and receive. Unlike in exhibitions and in other works created in an artistic context, the productions made as part of an art therapy are not intended to be presented to the public or to other carers. Each art therapist has the experience of being engaged in the creative process pathways. The talking technique in relation to the artwork has its reference located to art history. Let me back some of my things. Where am I? Yeah, where are my other pieces of paper? Hang on a second. I've got the pieces of paper. The benefits. Benefits. Okay, can you go get my papers? Okay, here we go. So now what I'd like to talk about is, we would like to talk about the benefits of art therapy. So sorry?
Please.
Sorry? Yes, they reduce symptoms of acute and chronic mental health conditions. They can enhance the ability to manage acute and chronic medical conditions, improve cognitive and sensory motor functions, and improve self-esteem and self-awareness. They can cultivate resilience, strengthen social skills, and provides healthy self-expression. So, would we say, is art therapy always beneficial? Well, the answer is no. Like any forms of therapy, you know, it can be detrimental, it can cause harm. Potential negative effects could include high levels of stress or anxiety, surfacing emotions without effectively processing them, difficulty in coping if therapy is abruptly terminated. So the art therapist is there to support the patient during this moment. They help them to express these feelings. So basically, this is what I want to say. Hang on just a second, because there's the question about further. There's one question that I want to bring up. So it's about how could this be used in other countries? So basically, art is universal. And it's a universal experience. And in every culture, people experiment art. So art therapy with formed therapists can be practiced in every cultural context. The only explanations needed are about the technical used and the setting of the workshop, the therapeutic workshop, that must adhere to the context. So art therapy can address multiple issues, especially relating to, for example, political repression, poverty, war conditions. So basically, I'd like to just share a brief experience of one of my Lebanese colleagues who happened to have had to go into the war zone. So she was there, and although she has all of her training, she's an art therapist, she has her tools, she has her methods. The thing is, she didn't, you don't have the CAD, you don't have this setting. Art therapists can go and work under any form of condition. Our CAD, our setting is with us. And so, she was able to use art therapy within this situation whereby these people going through these horrific traumatic experiences of war, and who needed to have an approach of the nonverbal. And so she worked with her, as I said, her tools and her methods. So anyway, in any context, art therapy remains a non-verbal technique that enhances the feeling of freedom through creativity. The whole experience also enriches one's sense of being the sujet, of being the subject, the one's self of developing more confidence, one's narcissistic assise, and the estime de soi, but also what it does. It provides a way of allowing for the thinking process to be more developed, for the thought process, and to be able to experience oneself within a group of enabling a whole new experience to be with the other. It helps in order to maintain a more affirmative position in professional and home and social life. So I think I'm just going to stop now. Okay, thank you very much. That's
we can hear you, Dr. Velasco.
Thank you very much. May I ask your name, because your camera is written Eric Bolzan. I doubt yourself as Eric Bolzan. What's your name, please?
My name?
No, of the colleague who presented.
Oh, didn't you hear me at the beginning? My name is Alison Fiona Bernard.
Alison
I'm an
Fiona
artist.
Bernard. Thank you very much. Because the name we see in the screen is Eric Bolzan. So it's obviously not you. So thank you. Alison Fiona Bernard. Is that it? Thank you very much. Thank you for your presentation. Thank you for being there, because we're really hoping you will be there as promised, and you were there. Thank you very much. I must say to both of you, I'm sure you wanted to be there. I must say to both of the first presentations that it was a very clear that even though it's very different kind of system, the kind of approach, and this is normal. This is one of the reasons why working together to look what different approaches towards art make it works. I must say to both of you that today is a very special moment, because we are only three, and you have more time that maybe you will have in the conference. But this is just to I think we're going to talk about it later. I am not going to introduce questions now. I'm also asking people, all the colleagues, to write questions in the conversation file in order to be able to give a little bit of a discussion at the end. So thank you very much, Alison. And I am calling Dr. Diaz from Mexico to give us an idea of how in Mexico you work with art, and why do you think it's a benefit for your patients? Please, Dr. Diaz, present yourself for the beginning.
Well, hello, good morning from Mexico, good afternoon to Europe, and good night to Asia. I thank you all of your presence, as well as...
Excuse me, Tony. We don't see you really. We're showing only the... Yes, please. We only see... There you go. Thank you very much. Thank you. It's going to be... Thank you.
Thank you. So, well, hello, everybody. I want to thank you all of your presence, as well as Dr. Alberto Velasco, for organizing this event and for giving us the possibility to be here at this moment, sharing our project with people all over the world. I was told I could invite the team, so we, Gali, Lau, Emma, Ruby, and I are here in Monterrey, Mexico, but don't worry, we will be brief, but we will try to be very clear. We are part of the Centro de Acompañamiento Terapéutico, Center of Therapeutic Accompaniment, also called CAT. This center is a new space for Mexican psychiatry since there are no institutional rehabilitation spaces, and here in Mexico we only work with consultation and hospitalization. It's basically an day hospital, and it was born from a cooperation agreement between GSU Santan in France and the University Hospital in Mexico. It has been open for 2 years, and we have a variety of artistic workshops during the week, but we will only talk of one specifically. We're glad to share it with you and tell you about our project from an experiential, theoretical, and practical experience, since we, the team, take different positions such as participants, workshoppers, or supervisors of the activity. So I will share the word to Emma, who is the supervisor of the workshops.
Hi, good day to everyone. My name is Emma Cerecer. I am a clinical psychologist and I am dedicated to private clinical practice in the city of San Luis Potosí in Mexico. I hope my English is good enough to be understood. I have shared, thanks. I have shared reflection space with Dr. Antonio in various activities since we have been part of the Franco-Mexican Association of Psychiatrists and Psychotherapists for a couple of years. Thanks to what we have shared in these activities, it was possible to arrange a brief stay in the center that he coordinates to develop an activity with the people who come to the CAT and the staff. The activity consisted in create a character who habits in Planet Zero, a fictional territory that was created specifically for the activity. The interest of this creation activity consisted of several things: that they create an imaginary context in which it was possible to imagine a character, for example, his body, his personality, his history, the way he can or can't interact with others and with the Planet Zero, that they landed the idea in a sketch, that they materialized the sketch in a sculpture made of clay, and that finally it was possible to conclude the fictional story of Planet Zero together. So as you can see, the intention of the activity slightly covered different clinical spheres, but why the concern to design activities based on artistic process? That was my question. Here I share with you a small reflection of what I consider most important in the clinical stakes that interact with artistic process. While it is true that for a long time the activities that have been prioritized in mental health treatment centers have been those that aim to psychoeducate about the mental condition, it is also true that since the creation of the psychiatric device, there has been a space dedicated to artistic activities. However, these have existed with the intention of providing them with a resource that allows them to materialize something that cannot be said or expressed, which means that the created object acquires the status of an encrypted message that must be interpreted by clinical staff. This is not the only thing that the accompaniment center proposed with its artistic activities. In that space, art is not taught as a mean of training, or it is not an occupational therapy that has the intention of teaching manual skills that subsequently allows financial support. So if art isn't those things, why should we introduce it in our clinical work? Which is its relevance? Does it really works for our patients? Firstly, the artistic activities within the center we are working in have the purpose of activating the psychic, affective, motor, and social process that have been turned off due to subjective suffering. We know that every condition in the file of mental health entails that there are skills that fail to develop that remain inhabilitated or that in certain cases begin a process of deterioration or regression. Also, drugs, various forms of psychotherapy, and orthodox treatment seeks to provide a solution of these symptoms, which are typical of various psychiatric diagnoses. They all come to notice that eventually their effectiveness stops. There are something that they can't solve. In this difficulty, the resource of artistic activities becomes a great support, but if we can conceive them under a very precise logic as activities that seek to launch process that have been coagulated or completely stopped. This means that what is important for us is not the product. What is important is not the process of teaching learning that artistic techniques as will happen in an art school. What we have very clear that the object and the beauty of and his beauty of its perfection is not our goal, but the creation process. Um, what is truly enriching in therapeutic work is to pay attention to the rhythm of the work, to the dynamic of thought around the object to be created, to the relationship that the person has or does not have with his or her body in the creation process, and to notice if they can play the game of the metaphor around the creation. In this way, it is possible to identify how the condition can be generated so that the patient eventually has the possibility of playing at begin or doing something else, that they have the possibility of living beyond the social, political, family, emotional, and subjective parameter that they have that the psychiatric diagnosis has imposed on them. As I was saying in the beginning, one of the resources that have been supportive in this interest has been clay. Through the molding work, it is possible for the patient to have a connection between their ideas, their hands, and their clay. This means that the clay generates an excuse to promote an activity that energizes the relationship between the internal work, and this means the world of ideas. We can imagine what we hope we are able to build, the external world, where the object is created with our manual labor, and finally, the body zone, which plays as an intermediate zone, in this case with the clay, specifically the hands. This dynamic activation can lead to various achievements. First, a body that has come to feel alien to getting the hands to build something in particular. Second, an internal space in which to develop an idea in order to materialize it. Third, the ability to create a space-time reference, because the clay forces us to generate a passage from the two-dimensional to the three-dimensional. That is, we have to go from the idea or the sketch to the sculpture. And for the game, and I think that this is the most important thing, the game of the metaphor. It is necessary to renounce the accuracy of the object that embodies the idea in order to create the object. Uh, and this means that the final object is not going to be the object that we imagine. In this way, artistic activities allow various achievements that make us consider them as indispensable activities in the center. But I think that also in particular clinical approaches, when the psychic process of the people who come for consultation are seriously paralyzed. And this is my participation. I introduce now to Laura. Thanks.
Thank you. Laura, it's your turn.
Hi. My name is Laura Manzano, and I reside in Monterrey, Mexico. Also, I attend to Therapeutic Accompaniment Center, commonly referred to as CIT or CAT, as usually we call it. There, we participate in creative activities, and one of that particular reason to me is sculpting, especially with clay. Working with clay takes me back to my childhood, where I would play with mud alongside my brother and cousin. Also, the tactile experience reminds me the time I spent with Play-Doh or slime during my kindergarten. Even though those times do not reflect the happiest moments of my life, engaging in this activity makes me feel like a child who doesn't understand the challenge at home and even is happy. Even through those times, as an adult sculpting with the clay forest my creativity as I focus on the way my hands evoke memories. I consider a form like a meditation, as it keeps me fully immersed in the present moment. I love making clay objects to decor my home. However, I enjoy more crafting functional items like ashtrays, cups, incense vases. I also paint the pieces to make them more attractive and colorful. Anything you can imagine, you can create. I love making clay objects. Sorry. One time we took a course with Emma at CAT to develop a project about building a character from another world or another dimension. It was very fun because we need to decide if the character had legs, wings, or tentacles, also where they live, how they breathe, and how they ate. At other times, I had the opportunity to play with my daughters and show them how to play works. Uh, Together, we make a little mudroom, trees, etc., just for fun, and that helps to create bonds with clay. Clearly, working with clay gives me the opportunity to relax and enjoy. It helps me that nothing needs to be perfect and teach me how to enjoy the little things in life, especially when you share it with friends and family. Definitely, I love all the activities at the CAT, especially the creative ones, like sculpt, paint, photography, art appreciation, acting, making craft things like piñatas, origami, and all of that. In fact, most of our visits at museums we, where we can appreciate a different kinds of art. Actually, is one of my favorite days of the week in the CAT. I'm a graphic designer and audiovisual producer, and all these activities encourage my creativity, especially when I make my paints at home. Art is a very important for mental health because you can explore new ways to express your feelings in a healthy way and heal your heart and your mind. I'm very grateful to Kat and Antonio Diaz Quiroz for giving me the opportunity to be part of it and teaching me how I can become a better version of myself to live with peace of mind and cherish the time I spend with my family. Thank you. Next, Kelly, it's your turn.
Thank you very much, Laura. Is there anyone else who's going to speak? Yes, please.
Okay. Well, my name is Galilea Carranza. Everybody calls me Gali. I joined the CAT last November, so I've been there like for. When Dr. Antonio told me for the first time about this project, I was a little bit doubtful. A part of me was really excited, but a different side of me was really scared of making a mistake, of failure, of not meeting expectations. I am a person who is more used to work with 2D mediums. I really enjoy working with watercolor, and I haven't worked much with clay before. So my technique is not as good as I would like. and that made me even more nervous. Um, there were many things that worried me about all of this, but the main one was the piece, the final result. Um, from the beginning, I knew that I wanted to do something more sculptural than utilitarian. I wasn't sure what I wanted to do exactly, so I was worried that I wouldn't think of something, not even something good enough. I thought that I wouldn't come up with anything. Um, I was worried that I wouldn't have the skills that I needed to bring my piece to life. I was worried of not having the skills. No, I think I think I'm repeating myself. I was worried I would not have enough time. I was worried I would not be able to get access to a clean, etc., etc. All of these fears were self-imposed. I actually talked to Dr. Antonio and I told him like, Tony, if I don't get access to a clean, the piece is gonna disintegrate and all of my work is going to waste. And Dr. Antonio was like, Lali, it's not about that. What I want to know is about your process, your experience. And I kind of wanted to cry because I felt like he didn't understand me. And sometimes I'm a little bit like a horse with blinders on. I can see anything but straight ahead. So at the time I was being a little bit like a horse. I couldn't see the value of the experience and I only cared about the final product. Um Actually, if I'm being honest, I thought I wouldn't learn anything from any of this and I thought I would have to lie here on the webinar, but that wasn't the case. Um Looking for a sense of control, I started to do some research. I wanted to know everything about clay, the techniques, the history, its uses, everything. And during that research, I came across an article talking about working with on fire clay. And I found it very interesting, but because in a sense, it defied everything that was going through my mind. When you work with clay and then put it through the firing process, the piece that you make will eventually dry and disintegrate. So almost everybody fires it. But the article talk about how because of the nature of clay, working with it, knowing that you won't fire it, makes the value shift from the object to the actual experience of creating. It isn't about pursuing a predetermined outcome. Instead, the focus shifts to our connection with the medium, to the creative process, to the process itself, the act of molding, shaping, and manipulating the clay. Again, at the time, I hadn't started to work with the clay, so when I read that, I was like, keep it. But when I finally started to work with the clay, I realized something very interesting. It is true that the route I took is a structured one. I started from a concept that required planning, and I had a predetermined idea, and my intention was to not give up until I gave life to that idea. But during that process, I realized that there is a different way to work with clay that is much more friendly. When we have a piece of clay in our hands, most of us instinctively want to explore it, shape it, touch it, poke it. And I think that, like that, almost like being unaware of it, we can work an entire piece just by playing with the medium. I also think it's a super interesting medium because I feel like it does not lend itself to lead you to experience paralysis choice, in the sense that facing a blank canvas can be very overwhelming. You have the nothingness staring back at you, and then you have like 30 different colors that you can choose from, and you don't know which one is the right one to choose. You can be like, what if I choose the wrong one? And when I layer a different one, it all becomes muddy. And for me personally, what I fear the most about the blank canvas is making a mistake because, because I paint with watercolor, the paper is quite expensive, and if you mess up, you can't do anything to save it. You have to use a new sheet of paper, and I don't like to waste my paper, so I'm really scared whenever I have to start a new project. And I feel like clay takes that pressure off, because clay is nothing more than that. It's just a ball of clay. And as long as your piece is not baked, you can always reheat your piece and it will turn back to its original state, and you can start again and again and again and again, and you don't waste any material. Something I also realized during this process is that I feel like when I work with a 2D medium, I'm always a step ahead. I'm always thinking how I will do X part, what colors I will need to mix to get the specific color that I want, and lots of different things. I can be here painting, but my mind will be very, very far away from here. And with clay, I couldn't do that. Clay is a medium that demands constant presence, physically and mentally. I also think that when I work with 2D mediums, I can allow myself to easily pause the process and go do something else. I can multitask, I can be eating while painting, and I can keep working with ease. But clay, I feel like it's a very demanding and even jealous medium. It wants you all for itself. Because of how messy and how physical it is, there are more barriers to cross if you want to go do something else. I found myself finding those barriers to be a hassle. And there were moments where I knew I needed to go and eat, but I would prolong the wait because one, I was enjoying the process a little too much and I didn't want to stop. Two, I actually wasn't that hungry, so it didn't matter. Three, I would think if I want to go to eat, I will have to wet my piece, wet a bag, cover the piece with the bag, make sure there's no air inside it, put it in a safe place so my cats don't knock it down, take off my apron, go wash my hands, clean the sink, put on new clothes, and then I can go downstairs and eat. And at that moment, to me, doing all of that wasn't worth it. So I wanted to keep working. Um, Now my piece. I don't know how to share my screen, so I will send it to you. But right now I can show it to you. A couple of weeks ago, I was obsessed with the song by Hozier called "I Carrion, I Carrion." It is a very beautiful song. It's a love song written from Icarus' point of view. And for about 3 weeks, I was playing that song on loop. So Icarus was in my mind for a lot of the time. And one day I was scrolling through Pinterest and I was like, let me look at some Icarus paintings. And what I found out was that all of the paintings, Icarus was a very beautiful man, but his wings were always impeccable. Uh, and I was like, why does nobody paint him with burned wings? Because he burned, he fell. Why does nobody paint him in that state? Um, I was really curious and I started to Google to find specifically images of Icarus with burnt wings, but I couldn't find any. So I thought, why don't I make the wings? And I make them look like are already burned. For reference, I used pictures of birds that had been on fires, and it was really sad to see. It broke my heart a little bit, but I was really driven by the aesthetic curiosity that I had at that moment. I really couldn't stop thinking about bird wings and why they might look like and how I could achieve that texture and that look with clay. Um, I actually went down the on fire clay route. I was really never nervous at first that it would all crumble down and nothing will be left and I would have nothing to show you. So I documented the whole process in pictures. Uh, when I was doing my research, one of the things that I read the most about was how with clay, we don't always get what we want, despite the hours of love and labor that we put into it. About how you can groom and beautify your piece, hoping that it looks just the way that you imagined it, but only a lucky few or very talented person will actually succeed in that. And the rest of us must learn to let go and of control and accept imperfection. So that's why I kind of went with on fire clay. Um, I actually had to restart my piece 3 times, twice because it all broke down, and once because for the most part I was working with brown clay, because that's what was available to me at the moment. But one of my colleagues at ELCAT, Eric, got a bit of gray clay for himself and took it to ELCAT and told me, I got this gray clay and I thought it would really help your piece. Do you want it? And I was like, of course. So I got it and I tried to use the least amount of gray clay as possible so I could give it back to him. Uh, and for that, I made my base with brown clay, and then I used the gray clay to make the details. Um, I must say, even though I'm the one here speaking to you, this feels more like a collective work than a personal one. This really wouldn't be possible without my colleagues at ELCAT. I normally would have been very too scared to even accept to work on this project, and I really wouldn't have accepted it if it wasn't for my colleagues. They were really, really supportive of my idea. They really nurtured my idea, and also they nurtured. Dr. Velasco, I can see you raise your hands. I can hear you.
Yes, I was kindly asking you if you may try to conclude because it's very interesting what you're
Yes,
saying.
yes, yes.
We'll have to have a little bit of time to discuss together.
Okay, 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 okay. I'm almost
Please.
finished.
Yes.
My colleagues were really supportive of my idea, and they really nurtured my idea, and they also nurtured my spirit. A couple of days ago, Dr. Antonio asked us what benefit those art bring to ELCAT, and it is true that as a therapeutic tool, art can help to find emotional release, and it can improve self-esteem, and it can help as a self-discovery catalytic. But I think that what I value the most about art in a place like ELCAT is that it builds community. Um, in the sense that we see each other almost every day, but I feel like we don't really know each other personally. We know each other in the context of the workshops that we work on. Um, but I feel like when we have the art workshops, it allows us to get to know each other more personally. We can ask questions that go beyond what kind of music do you like? What's your favorite food? Art really helps us delve deeper and it helps us strengthen ties. And I think that after a humanitarian crisis such as COVID-19, where isolation prevailed, community is one of the most important things we need to heal. That's all I have to say. So now it's Ruby's turn. Thank you.
Thank you very much, Guadalupe. Dr. Diaz is telling me that there's Ruby who is going to be very short in her participation. Please go ahead in order to have some time to discuss between everyone.
Sure.
Thank you.
Sure. I will be fast. Can you guys hear me? Sure.
Yeah.
Well, first of all, hello. Thank you for having me. My name, yes, is Ruby Munoz. Well, the thing is that I have an art degree. I'm not a doctor or nor a therapist. So maybe that could give us a different perspective in the results that we see in the CAT, in the center. Well, the workshop serves as a reflective tool around each of the decisions we make when producing our artistic projects. From the moment the idea is born in our mind and the entire route uh, that we developed to launch our ideas of the physical artistic material. Well, as a teacher, I personally do not seek perfection in technique, as is often required in art academies. Using some art therapy tools, my sessions consist of creating pieces that have more than sentimental and reflective connections with each of the members of the center. And well, this is my favorite part. Just as Gali told us, my favorite part of the workshop is that the result of seeing the evolution of each of the residents, seeing the development of the autonomy that they are forming in their artistic process, and seeing how step by step they become less afraid of experimenting with the materials, the techniques. At first, I remember that they questioned every move that they made because they were afraid of failing, as, is, as if that were possible in my class. After a few sessions, they stopped asking me what to do. Now they tell me what they are going to do, but more as a warning, more as sharing the process, and that seems quite valuable to me because they begin to feel their ideas and express them through art without fear of an eye that judges their work. And that is our main goal, I guess, that they feel comfortable at all, first in pieces and then in more complex decisions. That is why I consider it is relevant that we can replicate this project, because I think it could be easily reproduced in other places, in other countries, because we use simple materials, and of course because all the concepts and ideas that we handle in the workshop are reflected in their daily lives and in their autonomy. So yeah, I just finished. Sorry if we took many time. I'm so sorry.
Thank you very much, Ruby.
Sure.
No, it's okay. You made a big effort to resume it. I must say that I'm very happy to hear three very different approaches, and still not the same, but there's a lot of similarities in the words you have used. I know how precise is Isabel when she talks about her technique. This is a very important matter for her. It's a medical psychological therapist, and I know that she's been working a long time ago to be so precise. Thank you for that. I'm not going to make more comments for each one, but just to tell you that I know this is very precise, even though in another way, what Alison presented, and this is a very psychoanalytical framework. I know this. And the last is what the team of Mexico presented. I must say that I loved a couple of words that we used. Excited and scared, said Guadalupe, and not having the skills. Art as a support that produces things. This is what was I was hearing when you all talked. I think what art makes us produce things. This is what you said, creative capacity, and it's also an empowerment. This is something very easy to say for me. It's not that I'm not defining very important matters, but I'm not. I wanted to underline things that you have said, and Guadalupe says also not to give up. But this is what Alison said also, being a support and contain in order to help people being a force to creative of a creative action. So maybe we can say if you wanted to comment everyone's work, if you have questions one for the other, I am I'm ready to read them. If you have no, you haven't written any questions. So do you have some comments to say other other than what I was saying, and remembering how I will talk a little bit later about of plans for future. Is there any question, any comment of one of each other, and how did you receive? How do you understand the others' proposals? Do you want to share your feelings, not only of your work, but what the others said, the other colleagues said? Please be free of if you have something to mention.
I would just like to make a small comment on how, so here we are, my colleagues in Mexico. I think it was Nadia that spoke, the second person who spoke from Mexico. And like when she spoke, I just felt that we were completely using the same language. It was like, I completely felt in harmony with exactly what she was saying. It was very, very nice. And then also what I felt is this creativeness, if I may say, the how alive the presentation was, and the energy and the engagement, the investment, and just the art therapist and what they offer, what they give. It's it was very interesting. It was creative. I found it creative. The presentation, the authenticity, and so thank you.
Thank you, Alison, for your comment. Very, very true. Very, very living. Yes. Do you have anything? The idea is also to say if you didn't understand things with the other. This is very important because this is kind of a rehearsal, and we're supposed to be between colleagues in order to say, I didn't understand what you said when you were talking about this. We are going to make this once. We're going to send you the retranscription of every webinar and some recurrences of words, so we can try to share what are the words that are coming all together with, and try to see if they makes sense. So this is there anyone who wants to say something to another colleague? Is this do you have any comments, questions?
No, I guess if I can say something again, I found it very interesting. What is your name? Sorry, I have from Guadeloupe. What is it? The from Guadeloupe. Excuse me, Guadeloupe. What I found very interesting was when you spoke about the matière of the clay and how omnipresent that it was, and I found that as an art therapist that I am, that it was interesting, this relationship with the medium, because we're talking about our therapy, our medium, our mediation, but this was the relationship with the medium, and I found it very interesting, because also what you said, as art therapists, of course, we have a lot of references, anthropological, philosophical, lots of different approach. And what you said made me think of the phenomenology, because you said that when you had that piece of clay in your hand, it brought you here and now. And this is perfect in our art therapy sessions. It's like, we have this special relationship with the object, with the medium, with the group, the relationship with the therapist, the alliance, the therapeutic. It's like all of this kind of came up through your presentation.
Did you want to answer? Do you want to say something?
I focused on my experience with the medium because I think that's what was asked for me. And also it just came really natural because I studied digital animation for 2 years. And I had a problem using the programs. I am really bad with technology, so I suffered a lot when I tried to do a digital piece. But I also it was really interesting because even though I was creating, I felt a disconnection from my work and me. I knew that I did them, but I felt like they didn't have life, they didn't have a soul, and I really missed to feel the materials, to feel the paper, to get stains on my clothes. And so working with clay was really magical to me. It is true that just creating is really magical, but to me, the magic of clay resides on the physical stimuli. You're constantly being anchored to the present moment, and there's no way to escape the process of creating. And I think that's what happens with me when I am drawing, but with clay, it didn't happen. I love it. I really do.
It's a magical phrase. Creating is very magical, you said. Thank you
Mhm.
very much. It's a very nice way to say things. Um, is there anyone else who wants to make a comment or yes,
Yes.
If I can
please,
say something else,
yes.
yeah, thanks. I hope I I can say it well. Um, I really think that in art, in clinical context, it's really important to think that we are not focused, we're not concentrated on creating an object only, only, because creating the object can be also very important if it uh, activate a process, mental process. But I also think that there are something that getting action that it's not well uh, no se alcanza a notar. It's not well. For example,
Appreciate it.
they can build body, they can build time, they can build space, they can build an internal world. Maybe the patient, the person who is constructing an object, they cannot realize it. But when that's why I think it's really important to do it with a person that has form uh, in that is someone who has the form clinical. I mean, a psychiatric, a psychologist, but also the person who has the form, the artistic, the artistic studies, because it's not only the creation of the object, but all the things that are concerned about it. I want to subrayarlo, I don't know how it says. Um, it constructs body, time, space, affection, um, communication between person, and I think
Mhm.
that is the really important thing about art in this context. Thank you.
This is, thank you very much. This is very precise also. Permitted to connect with each other. Yes, I think we've said this before. When museums talked about what they feel, it was the benefit of arts, permitting everyone could be connected to the others. This is what Ruby said also. Well, this is a very nice moment to share. Unfortunately, the time is passing. I must say that I'm a little bit unsatisfied because I would love to hear more of these comments, but we are a little bit late of our time. And let me I want to tell you something I announced that this is our webinars are aimed to hear what the others say. How did they say? To learn about them. I learned a lot of things today. Thank you, Isabel. Thank you, Alison, and thank you all. Isabel, you have already said this before to me, but this is the first one I learned so much. And how did everyone uses art? This is must of the bet we set. We had the bet is to see if art makes it works in different kinds of parts of the world. What I wanted to say is that we are working for a conference. We're going to be a little bit more precise when with my time. I think today was very easy because we were not four, we were three. I think I might be able to propose you some comments in a part. And of course, I wanted to say that our conference in September is a very important moment because we're going to be producing a work with 12 countries. I mean, people from different kinds, parts of the world, which might let us produce also something that might be called a consensus. This is a very ambitious thing, but we're trying to work in order to make it look to be a consensus. This is not going to be easy, but it will be one of our targets. And then at the last of everything, I wanted to say that we have another possibility, as I said in my last mail, working together also for a Congress in Japan, September 2024. I'm going to write it down in our next mail, but I want you to announce it now because you will be able to think that we're working together now. We're going to be working together every month. We're going to see on September, and we're going to try to work together once again in Japan. So be free if you want to share things or amazing. Be free if you want to ask. So one of you, Isabel, asked you to have your questions written. And be free of asking everyone's others advices. This would be the best thing that could happen to us. I am awfully sorry to conclude this session because it was very nice seeing how things were shared. Thank you for all of you for your energy, with your capacity to create a moment. This is also true. Thank you very much for everyone. And we'll be seeing you
Thank you, Alberto.
April the 26th. And thank you with everyone in a special thought to people in Ukraine. You are there. Thank you very much. Thank you.
Thank you.
Thank you. Thank you.
Thank you.
See you.
Bye.
Thank you
Bye
so
now.
much.
Bye.
Bye bye. Bye.